The COVID-19 pandemic has changed the way that a lot of us shop for the items that we use on a daily basis. But how has the pandemic affected our local pharmacies? Adam Poston from P&S Pharmacy in Kingsport is here to discuss the role of pharmacies during the time of COVID. Appreciate you being here today.
Hey, thanks for having me.
Let's talk about that. How has COVID changed the normal visit to the pharmacy?
Well, you know, I think everybody, regardless of what business you've had, you're in, you've had to back up and punt. I know, and specifically to the pharmacy, we've been cleaning more. You know, we put up some barriers where we're utilizing our free delivery service. We're utilizing curbside pickup.
Right.
There's been a lot of telemedicine taking place.
And telemedicine is such a big deal anymore. I mean, it is so vitally important, and y'all are becoming experts in that, aren't you?
Oh, absolutely.
Yeah.
Yeah, we are really going out of our way to see if we can try to utilize every aspect of anything like that to keep moving forward for all of our patients.
And I know a lot of folks, you know, when they have the pharmacy, they have multiple medications and prescriptions that they have to keep track of, and y'all do a lot to help them keep track of that, don't you?
Oh, absolutely. We have a couple different ways that we help manage medications, one of which is our dispill service.
Right.
That's actually the example I have here. This is a...
Got the medication back there, but it's candy.
It's candy.
Yeah.
We cheated, but this is actually for Scooby-Doo.
Right.
And you flip it over here, and it's going to break everything down. Right. We're going to pretend like this is 30 days worth of Scooby-Doo's medications.
Right.
So it's going to break it down by what's in there, what date you're supposed to take it, and it's got morning, afternoon, evening, bedtime. And then up here is a complete med list. So when Scooby goes to the doctor, he can just tear this off and stick it in his collar, and everybody's aware of what he's taking.
And that is so, you know, there's a couple things here with that. It's the convenience aspect of it is really great, but the safety aspect of having this is so vitally important.
Absolutely. You know, we've been doing this for a while, and I get a lot of feedback from patients, but most of my feedback comes from your caregivers, your sons and daughters who are having to spend 4 or 5 hours every Sunday going through medication. You know, they're not sure what to put where. We actually take care of all that for you. And then that way it gives everybody, whether you're a patient, whether you're a caregiver, whether you're a son or a daughter, it gives you time to actually go and do what's most important. That's spend time with your family.
And it gives you all peace of mind knowing that the medications that you're dispensing are getting taken in the correct dosage and at the correct time.
Absolutely. And these are completely adaptable. You know, if you take medicine just in the morning and just at night, we can adapt it and customize it to whatever your dosing schedule is.
And let's talk about, you know, we talk about so much about this time of the year, you know, insurances are doing things, money as far as prescriptions, as far as health care. Y'all can help folks out with their, like Medicare Part D and helping folks out with that side of things as well.
Oh, absolutely. You know, I've become kind of an expert in Part D. You know, it's been kind of a curve because of 2020. But I do a lot of research, and we have people, they'll come into the pharmacy, and what we do, we'll go out and we'll contract with all of these pharmacies.
Right.
And we do that under the impression that we want as many people as we can get to come in, and we want to be available for anybody who would want to use us. Right. So what I can do, you know, first of all, we're preferred in more Part D networks nationally than any of your other pharmacies around. You know, your box stores, your groceries, you know, any of those places. We're going to have either the same or cheaper copay as they have. So a lot of people don't realize that where we're an independent pharmacy. If your prescription is $3 at the grocery store, then it's going to be $3 or cheaper at P&S. And, you know, moving in, you know, right now it's open enrollment.
Right.
So
a lot of folks are going through open enrollment.
It is. It's a big thing. It's a big scary process. It's a lot of confusion that goes with that. So you can contact me. I can either come out to you, you can come to the store, we can do it over the phone, whatever's easiest. And I can take the medications that you currently take, put them into the Medicare Part D website, and it's going to give me a detailed list of all of the plans available for 2021.
How convenient is that? I mean,
it's perfect.
To have that expertise a phone call away.
Well, you know, it helps alleviate any confusion. It helps take the burden of what am I going to do off of anybody who would want to come and do this. And at the end of the day, we're going to help you find a better plan that's going to save you some money, that's going to make sure all of your medicines are covered, and it's going to be less of a headache for you. So I would say that's a win.
It sounds like from the time that prescription gets to your shop till it gets back out to the person that's going to take it, y'all are taking care of pretty much everything.
Absolutely. When you come to us, I want you to know that you're utilizing us as your pharmacy team.
All right.
So from start to finish, we take care of prior authorizations, we take care of refills. We can use our MedSync program to help, if you don't necessarily want the bubble pack.
Right.
And it keeps it in the bottle, but it gives you 1 month of supply of your medication at once. So you don't have to make 15 trips to the pharmacy.
That's
you just
so
come in
helpful.
once. And another thing that we offer is free delivery.
Oh.
So if you are picking up your parents' medication or picking up your medication and you're at work or you're afraid you won't get there by the time the pharmacy closes, call us. We'll bring it to you. No problem.
Can't do better than that.
You can't.
Adam Poston, thank you so much for taking
thanks
the
for
time.
having me.
Absolutely. Folks, it is P&S Pharmacy. They're located right there on Watauga Street in Kingsport, Tennessee. Give them a call today and we'll have that website up as well.
The preceding portion of Daytime Tri-Cities was sponsored by